So today we are going to talk about the wonderful subject of anatomy. So what is anatomy? Anatomy is the study of human body. So anatomy is basically a subject that deals with the architecture of the human body, like basically uh, how things are inside the human body, like where are the bones and where are the organs, like what is the body made of, like what organs are there, what are their functions and stuff like that. So anatomy is basically the study of human body, the study of human architecture. So the second question before we start talking about anatomy is, why do I even need to study this stuff? So why is it even important? So the reason why we study anatomy is, it's pretty simple, because it's used in surgery and diagnosis. So we study an anatomy because it is used in surgery and diagnostics. So if you do not know where the heart is in your body, then how are you going to perform a heart surgery, right? So in order to perform a heart surgery, you need to learn the anatomy of the heart first. So it's basically used, uh, like you need to learn the anatomy first before you can do the surgery. And the second thing is, it's used in diagnosis. So if a patient comes to you and says like, my belly is like, there's pain in my belly area, so it could be anything. It could be the diaphragm, it could be the intestine, it could be the liver or gallbladder, or it could be any organ. But if you can pinpoint, like with your knowledge of anatomy, like if the patient is saying is like left belly is paining, then the doctor can understand that his stomach, like his cardiac end of stomach, is uh, paining. So like it's something to do with the stomach, not the liver, because the liver is on the right side. So it basically helps doctors to figure out what part of the body is affected by that certain disease. So in order to understand that, obviously you need to know what are the organs in different parts of the body. So that's why anatomy is such an interesting and such an important subject that all medical students need to learn. So so there are like basically two parts of anatomy. So the first part is theory, and the second part is clinical. So the theoretical anatomy, this one. So the theoretical anatomy basically deals with the theory of the body, like where is the heart, where is the lung, where is the liver, what are the parts of the heart, what are the parts of the brain, what are their functions. It's like basically the bookish stuff. It's in theory. And the clinical part is, this is much more interesting, because like the clinical part is basically how this information is used in real life. So like in order to understand the clinical part, you need to understand the theory first. And clinical is basically telling you how as a doctor you can use the theory to treat your patients. So like for example, if you are learning about coronary uh, myocardial infarction or heart attack. So there's a part in which we have to learn like what happens during heart attack. So so we learned that in the theory part. So what happens during heart attack? It's basically like the arteries in your heart get blocked, and then your heart does not get enough blood, and its muscles start dying and stuff like that. So during a heart attack, the patient gets pain in the chest area and also the left arm. So the theory of heart attack is there, but then what the patient tells you, like the patient, when patient comes to you, the patient won't tell like, oh doctor, I have a heart attack. No, he will tell something along the lines like, I have like my chest is paining and my neck is also paining and I have difficulty in breathing and my jaws are like rigid. So like, but like the doctor has to understand what the patient is saying and use the knowledge, like the theory, in like the hospital, like in the clinical procedures, to treat the patient. So like, if you first of all you have to understand the theory, and then when the patient comes to you in actual real life and tells you about his or our problems, then you can use this theory to treat the patient. So this is how to use this information is taught in clinical. So basically, if you want to be good at anatomy, you just like, you can be good at anatomy just studying out the theory stuff. You also have to learn about the clinical aspects of the theory, how to use this information in real life. So personally, I like clinical more than theory because it's like much more interesting. It makes theory interesting. So yeah, there are two parts, theory and clinical.